Congressman McCormick, you have a very unique perspective on the government's role in healthcare.
It's the biggest spending item in government. 25% of all of our spending. Congress has no idea what a doctor does or what a patient does. Hospital systems are always required to treat patients. By law, if you come in to see me.
You were one of the only congressmen that served patients during COVID. Congressman McCormick, thank you for joining us today.
It's good to be with you.
I
Thanks.
appreciate it. Yeah. And today we want to go over, you have a very unique perspective on the government's role in healthcare. As an MD and as a congressman, you've got probably one of the most, unique perspectives that I think may exist in the United States. And as we get into that, as a medical doctor, as an MD, what has been the relationship that you've seen between government and healthcare?
It's central to healthcare. If you think about it, it's the biggest spending item in government. It's about 25% of all of our spending. It's about 31% of our mandatory spending, or what we call non-discretionary spending. There should be no such thing as mandatory spending in government, because that means that Congress has no control of the budget. We do have control of the budget, but we're always scared of the mob, if you will, to do the right thing, because nobody wants to have anything taken away from them. And the way that the opposition will always spin it is even if you're trimming fat and waste and fraud and abuse, you're driving grandma over the cliff. That's the way they'll spin it in order to defeat you in an election so they can take control. It's unfortunate because it should be a bipartisan issue. Right now we spend about half the money we spend on healthcare in America is spent by the United States government through either Medicaid or Medicare. That you have hundreds of billions of dollars of waste, even fraud. In Medicaid, for example, in the lack of ability to confirm your ability to qualify in income, which is not part of the actual application process. We now have a bill that we're going to come up with that requires you not only on application, but biannually to prove your income level so that you can actually qualify for what essentially is another welfare program. Very expensive, doesn't pay the bill for the hospitals either, by the way. But Medicare and Medicaid are huge problems in the United States. If we don't do something to shore up Medicare, it will have an automatic 11% cut within a decade, and that will drive the whole healthcare system into pandemonium. Or it'll drive us into so much debt, we're going to even compound the problem we already have, where our children will never be able to pay it off, and we'll be a nation of has-beens.
When you look at when you were an MD, before you were a congressman, and you looked at, you've talked about providing so much care to people, but also people, during the pandemic. When you were in the front lines as an MD, how did the government interfere with your role, or did they, as an MD in caring for patients?
Well, some of it's in what they enforce that they shouldn't. Other is things that they don't enforce that they should, including payments. When you consider that hospital systems are always required to treat patients, you're always, by law, if you come in to see me, I have to have an evaluation to make sure that you're safe to be released. Anybody who doesn't think that there's not a healthcare net out there doesn't understand how healthcare and laws are. If you come to the ER, you're having a heart attack, a stroke, or something life-threatening, I have to not only evaluate you, but treat you until I can get you out safely. That is the law, regardless of any payment or any. You don't even have to be a citizen. Matter of fact, you come here from a foreign country and you're a foreign national terrorist, but we haven't identified you. You can come to the hospital and be treated just like everybody else. Matter of fact, go ahead of people who actually have insurance and are citizens, because you are in dire consequence, and we will treat you. One of the problems we have right now, though, is in order to get reimbursed, we've done this little cat and mouse thing. It's an arms war, if you will. They made it harder for us to get reimbursed because they have more and more requirements. Some of them are good because it helps us chart better and track better, like the electronic medical records. But the burden of proof that you saw a patient, you did what you did, gets more and more. Every time we get better at it, they ask for more, which means more administrative time, which means less time with the patients in order to see the same number of patients. That's why we have scribes now taking notes for us. We have an EMR system that's supposed to be streamlined. And that's why I stay hours after my shift, which is non-reimbursed, not like a lawyer. As I'm working hours after my shift, I'm not getting paid for that. But I'm making sure my note is concise. Yet, an insurance company can give me a denial up to 40% of the time in recent times where I've seen my ER group got 40% denial from insurance companies, for certain insurance companies. And then Secretary Becerris, and there you go into your government and regulation and actually doing what it's supposed to do, will not hold them accountable. And so you have 4 of the top 10 companies in the United States are insurance companies with record profits. 8 straight quarters of record straight profits. 7 of the top 20 businesses in America, insurance companies, that are denying you 40% of the time on your. So what does that mean? That means that the American public has to pick up the bills for these hospitals to stay alive. That's when we try to modify the way we do Medicare and Medicaid reimbursements to keep them alive and healthy as hospitals, because insurance companies aren't paying what they're supposed to pay by law.
Right.
And this little, and by the way, they're the biggest lobbyists in federal government. They have more money than anybody. So we're fighting that all the time.
And jumping back to what you talked about, the care that you are that you have a right to is in any certain emergency, no matter who you are, is under the EMTALA Act, correct?
Correct.
And that was back in 1986. And how do you see that specific EMTALA Act as, is it any sort of snowball, or what is your viewpoint on that?
Well, it was to keep us from discriminating against people who couldn't pay their bills. And it's a good law in the sense that you don't want people who are impoverished to come to the ER and they can't pay their bills. I'm not going to see you. It was to keep that from happening. But it's been abused massively when you have 10 million plus illegal immigrants come in and literally come to your hospital and now have babies at however much that costs, $20,000 a pop, $100,000. But what if you had come in preemie? Now you're in the NICU. You could have hundreds of thousands of dollars for one person's birth. And by the way, now we're on the hook for that child the rest of their lives because their parents just came here because they were impoverished to begin with. So now you're going to be paying for their health care, maybe their premature health care, all their medical bills, all their education, all their special needs, because they're probably going to have some special needs because they're born preemie. We had a guy who, when I was training at Grady, had been in an automobile accident and was paralyzed from the neck down. We couldn't get him out of the hospital. Mexico would not accept them back. He was $1 million spent over the course of a year where he just sat in a bed. And we took care of him because he couldn't be discharged and he couldn't be sent home. And it was ridiculous. And there was no law to protect hospitals from that consequence. Because now that's a toll on a hospital. Almost closed. Grady almost closed because of the payer mix. Atlanta Medical Center, the only other Trauma 1 center in Atlanta, did close because of the payer mix. Once again, if you have too many people on welfare, people who can't pay bills, people who are indigent, who come to your hospital, who have no other way to pay for the bills, how is that hospital supposed to sustain itself? Right. And you have these hospital systems who buy a chain of hospitals that are associated with each other. And then they'll find the one that's not profitable and say, look, I'm losing $1 million a month. I can't afford this. Close the hospital. Now I'll take the profitable ones, and then the rest of that load will go to Grady. Now they have to figure out how they're going to stay alive. And that's how you can have the succession of closures in the inner city or in rural areas where the reimbursement payer mix is not very good. Suburbanites are always fine because most people have insurance and most people are able to pay out of pocket too. As a matter of fact, that's why dermatologists do very well and plastic surgeons do very well because they don't accept insurance. Everything's paid out of pocket. Now, ironically, if you go to a hospital and you don't have insurance and you pay out of pocket, it's actually cheaper than what the insurance rate is. And it's a lot of times cheaper even than what we reimburse these hospitals for. Because
I've actually experienced that myself because I have a shared healthcare policy. So I've looked at that from once I became an entrepreneur and having to have health insurance for myself, not through, a certain company, being able to understand how negotiable some different rates are and what that looks like. What could have been done to save something in regards to the hospitals that have closed? What could be done in that regard in terms of what could be done better in terms of the people that have been treated that under the EMTALA Act? What could we do as a nation, as a government that could help that situation?
Well, first of all, make sure that American citizens come first. If you're going to invite people wholesale into your country with no plan, that is ruinous to a country. That's why when we had literally over 10 million people come in the last 4 years into this country illegally, you can't claim asylum from Mexico. Mexico has plenty of jobs. It has a good education system. It has energy sources, proximity to the United States. Okay, so you make less money over there. Okay, so it's going to be harder to achieve things over there. That's not the reason you claim asylum. That's not the way it works. And yet Joe Biden made it that way. Yeah, in my opinion, there's no reason to let that many people in the country. By the way, 2 million of them, we don't even have any accountability for. They got away. He was trying to spin it like, oh, I sent a record number of border agents down to the border. To do what? Not to stop them, but to document them. So when he calls them undocumented immigrants, well, first of all, they're very well documented, and they're not immigrants. You're not allowed to immigrate here. You're claiming asylum for no good reason. You're actually well documented illegal invaders, if you really want to give a good label.
Yeah.
Now, you're going to be paying for all those guys when they come here, whether they distribute fentanyl, which we had over 100,000 people die, which is a huge burden on our medical system. When you come to the ER, and every single night in the last year of my ER, which my last shift was about 2 years ago, every single night I had an overdose. Sometimes up to 4 overdoses in one night. I lost 4 patients in 1 year. The youngest one was 17, the oldest was 37. Where do you think all those fentanyl overdoses came from? The southern border. That's another burden on our society. If you look at the addictions, for every one person that comes to ER, you probably have 10 people overdosing that night or coming damn near close. And the burden on those families, on crime, on what that results in, it's all coming from the southern border. The gangs that are here, that's a burden on our jail systems. But the healthcare system alone has so many intricacies. Now, you can make a hospital more efficient like Grady, where they came in and revamped it probably I think it was about 2008, 2009. They made it much more efficient. People resist it, but they're having problems getting people to surgeries on time, on the efficiency of people getting discharged. Once you make a hospital efficient, that's one thing. But the payment system, the payer mix, the ability to decipher who's trying to game the system, those people who are pain-seeking and trying to burden the system in that way. There are so many multifactorial issues, and some of it's the autonomous nature of a hospital and how it's managed. Some of it's the way the government interacts with it, some with the insurance companies. We've had several hospitals that we didn't accept in Northside, for example, Kaiser at one point, and we had another problem with Blue Cross Blue Shield another time. As you recontract, it gets stingier and stingier, and it gets harder and harder to afford your hospital system. Those individual contracts and the way they tie in with PBMs and for those people who know how PBMs are vertically integrated to the system, and the pharmaceuticals and everything else like that, incredibly, the most expensive, complex system in the world is right here. Matter of fact, we spend $5 trillion almost on healthcare in America per year. That's the same as the 3rd largest economy in the world by itself.
Well, it's interesting you bring that up because something that I wanted to talk about today is RVUs. Right? The relative value unit, which sounds kind of vague in and of its own definition, right? And how big of a role that it plays in the average American's life in the terms of healthcare. Can you explain to us in simple terms what RVUs look like?
So an RVU is basically the work that you do that you bill for. Procedures, for example, get higher RVUs than seeing a patient. This is what a lot of primary care people complain about. In other words, if I'm doing proactive stuff to keep you healthy, I don't get credit for that. I can bill you for even talking to you about smoking cessation, which is a small bill, obviously. But I'm going to get much more reimbursed by putting a chest tube in you, or by putting an ultrasound guided IV in you, or by intubating you, or doing CPR on you. Now, some of that stuff makes sense. It takes more time and it's much more high level stuff. That's why orthopedic surgeons make a lot of money, because they're doing actual procedures, surgeries. It's something very tangible. Primary medicine is not nearly as tangible because I'm examining you. Now I have to put in a certain number of your physical. I need to put in your history. I need to put your exam, the deductive reasoning that I use in your medical decision making in order to get a level chart anywhere from 1 to 5, and they'll give me how much I can bill you for that chart. The problem is that when I go through all this EMR and I do all the things I'm supposed to do, and then I submit it to the insurance company, they're like, it's not good enough. And that will vary based on what note I give on what they think isn't good enough. And then they're not held accountable. So when they don't pay their fair share, the only way to make that up is either ask for more from the government or some other modification. This is why it's a constant push-pull and arms war of what you deserve on your RVUs versus what I put in for billing and what I'm reimbursed. It's all separate issues because a lot of it's subjective.
Yeah.
Now AI can solve that, by the way.
Right. And I understand there's a lot of perspectives that could change that. But in terms of the patient, how should the patient, and I'll be honest with you, as looking, into this podcast itself, I was looking at RVUs and I was like, I have no idea how that's affecting me. How is that affecting somebody listening to this right now? How is RVUs affecting them? And is there anything that they can do about it?
Nothing a patient can do about it. This is about the way the government regulates medicine. But quite frankly, it's not Congress voting on this, by the way. Congress has no concept of what an RVU is. Congress has no idea of what EMR is. Congress has no idea what a doctor does or what a patient does. As a matter of fact, what keeps on happening is patients keep on paying more and more. Doctors make less and less. The two people, by the way, involved the most directly in this medical concept, in other words, the way we do medicine. But yet insurance companies are making record profits. PBMs are making record profits. The patients have no control over medicine, and neither do doctors. That's the scary thing. We used to have about 12% of doctors working for hospitals. Now it's approaching 80%. The more and more we get forced into a hospital system, the more expensive medicine becomes. Now here in Georgia, it's very much become monopolistic because we have certificate of need. I can't give any sort of competition to a hospital in a certain region because we want to make sure that hospitals aren't put in a competitive position. They're put out of business. Well, if they're put out of business, that means the other hospital was doing something better. I am totally against that. Now, I think we need to adjust our loads slowly, that hospitals can adjust. I know I'm going to make some hospitals mad just by saying that, but I'm very much into driving the price to efficiency. Let me give you an example. If you went and had LASIK eye surgery 40 years ago, it would cost more than it costs now. Obviously, we had a lot of advancements in technology in the last 40 years. But if insurance companies were required to pay that bill, if it wasn't elective surgeries, then it would be a set point, and then every year it would get an advancement in percentage, not based on anything other than, well, of course, we had inflation, so we're going to increase the price point of that surgery for your eye. So since it's not, it's actually cheaper than it was 40 years ago because it's become more efficient and more competitive. And so you get a better product for a cheaper price 40 years. But if it was required by government to be a mandatory spending item, it would actually be probably 10 times more expensive, and it'd be another burden on our insurance companies and on Americans who require it by Medicaid and Medicare as well. That's why I say transgender surgeries, for example, not to get too controversial, but when I was going to medical school, it was considered a psychological problem. You're a boy, but you think you're a girl. Your chromosomes all say you're a boy. Your hormones all say you're a boy. And somehow or another, you still think you're a girl. But you think by taking hormones that you don't have and having surgeries on your body to look like you don't look is going to make you feel more like you feel. It's kind of counterintuitive when you really break it down, because the problem is that even after you have that surgery and those hormones and people treat you differently, you're still unhappy. Almost the same exact percentage. As a matter of fact, if you look at most, probably around half, if not more, of the mass school shootings lately have been people on hormones who are transgender who have psychological issues. It's not making them happy. They did a study at UCLA, which is a liberal school, a medical school, on why these people who have this transgender problem, why they're unhappy. And 40% of them have suicide attempts, 40%. But it doesn't matter what they look like, how they're treated, or they did multiple approaches to what is the cause of the suicidal. It's because they already have a problem with feeling good about themselves that you can't fix with surgery or hormones or the way people treat you. It's a problem with your head. And we've always called this a psychosomatic disorder, but now we want to politicize it, and it hasn't helped anybody get better. And that's why we actually have way better outcomes for stroke and heart attacks and other things. We have some of the best medicine, some of the best treatments for cancer. It's just too expensive because we do some really stupid things along the way.
And I think that goes directly into the transparency aspect that you talked about, right? Like President Trump was interviewed before his election, before he won the election or anything like that about pricing transparency and his requirements around it and things like that. And why do you look at pricing transparency as so important for the average listener out there?
It's only the first step in correcting the problem, because it doesn't fix the problem. It just shows us where the real waste and fraud is. It shows us that PBMs are not being honest in the way they're applying their pricing. It shows that pharmaceuticals are paying vast different. If I, for example, and this is just a made up figure, but this is essentially what's happening. If I go down and I get a prescription for Augmentin because I have an infection, some sort of skin disorder or something like that, and physician writes me a prescription, now I can do a couple different things. If I'm on Medicaid, Medicare, it's going to be different prices for those to different pharmacies. And then on top of that, if I have an insurance company paying for it, I'll go and get, I don't care which pharmacy I go to because my insurance company is going to pay for it, even though the prices are drastically different on each place they go to.
Yeah.
So if I go to the most expensive place, well, the insurance company by law can upsell that because let's say they pay $80 for it at Publix. Well, they're going to charge you $90 for your insurance premium averaged out amongst all the people. Nobody cares because they all think, well, it's being paid for by my insurance. Not realizing that your insurance premiums are affected by how much you pay at the thing. Now, ironically, you still have a deductible you have to pay. Let's say I have to pay a $5, $10 copay, right? That's to keep me accountable so I don't just get prescriptions all the time willy-nilly.
Right.
Well, ironically, if you paid out of pocket, it'd probably be very similar to the price you did on your copay without the $80 that the insurance company just paid to the pharmaceutical company and the 10% you just paid for the pharmaceutical company. So instead of paying $90, you would have paid $10. And guess what? Your insurance premiums just went down by that much. The insurance companies and the pharmaceuticals didn't make all that money, and we're all better off. But that's not the way we gear it. We're so conditioned by design to do the wrong thing because we haven't been motivated and educated to do the right thing that our healthcare system is literally broke right now.
So if we have pricing transparency, how would that change for the average listener out there?
It shows where the money is going, where $5 trillion is going, both out of your pocket through insurance companies and co-pays and out-of-pocket pays versus the half of that, which is paid by the United States government through Medicare and Medicaid. Where is it going? We know in Florida, we had hundreds of thousands of cases where people, it's one of the worst cases for Medicaid fraud, where you basically make an application for Medicaid, they put you on there, they get their little cut, the insurance brokers and the insurance companies gets their cut, and then you don't really qualify for it, because there's no burden of proof for verification. Just getting rid of that kind of stuff can save us billions of dollars. We need to be very, very strict with the money that we, the taxpayer, are paying, because right now we have a $36 trillion debt. Every 100 days, we're just adding another $100 billion on, another $1 trillion. So this whole idea of, Ukraine, I'm just going to make it a little more political for a second. When people get upset that we're spending $100 billion on Ukraine, I'm like, that's 10 days of deficit spending. Not 10 days of a budget, that's 10 days of deficit budget.
And on that topic specifically, we researched that during the Republican National Convention, you were quoted saying, Biden, through bureaucracies and executive privilege, basically cut $300 billion from Medicare this year, being 2024. And that money went to electric vehicles, the pharmacy benefit managers that you've talked about, and to deal with the immigrants we've got here. If Medicare doesn't need the money, why are we spending so much on it? We're either stealing from Medicare and people aren't getting the needed services, or we didn't need it in the first place. This last statement on the lack of care, potentially, of patients, or the fact that we just didn't need the money in the first place, has that question been answered?
No, and this is what I don't like. I don't like the way that we're pilfering different systems, whether it be Social Security, Medicare, Medicaid, different government agencies, and this comes back to bureaucrats and how they. Another perfect example is FEMA, right? FEMA is set aside for emergencies. They have a certain amount, billions of dollars, to help people with hurricanes or wildfires or whatever it is. That's the way it's organized. This last year, we had 40% of our FEMA. Now, remember, we just did an emergency bailout of FEMA of $100 billion. We voted on it in December, right before we went on break. $100 billion. Guess what? In our budget for emergency, how much was pilfered? 40% for COVID in 2024. I don't know about you, but I'm pretty sure COVID wasn't a thing in 2024. But this is how inefficient we've become. This is how we got locked into bad laws, bad contracts. And I've heard the speaker say, well, it's going to cost us more to fight this in court than to pay it. Fight it. Make it painful. We do it on insurance all the time. We do it on other government contract all the time. Let's do the right thing, because this is ridiculous. We're paying so much money on things that are people just raping the government for money that they shouldn't have. And I'd love to expose that. There's your pricing transparency. There's the money. Who did it go to and what did it pay for? Because as far as I know, COVID's not a thing anymore. Now, it's just like the flu, but you go to the doctor for it. You don't get special payments for it. You don't get special reimbursements for it. COVID is no longer a special entity as a pandemic. Let's stop being stupid with the way we disseminate our money.
So in your eyes, your answer to the question would be that we have put too much money into that equation.
Or it's going to the wrong places, and that's why it's going to go bankrupt. That's why you're going to have an automatic 11% cut within 10 years. If you look at the digression where the points are meeting, where it's going to become insolvent. And either we're going to vote, and what I'm predicting, because I'm getting cynical the longer I'm in Congress, is instead of doing the right thing, which is making it more efficient and saving the system, we'll just keep on pumping money into it because it's hard to maintain control of Congress and the Senate and the presidency all at the same time and do the right thing. Whenever the Democrats come in, they think the answer to everything is just increase taxes, increase payments, as if we're a bottomless pit. We tax about $5 trillion in revenue through different taxation and other things into the government, but we pay out $7 trillion per year. We have a 30% deficit. So when you talk about making a 10% cut to discretionary spending, which is the non-Social Security, non-Medicare, non-Medicaid stuff, if you do a 10% cut, it would be the biggest cut of all time, money-wise. But you're only making a 1% cut when you compare it, like when you take the military out, which is another 15%, you only have 10% of the budget left. If you do a 10% budget cut of that, that's only a 10% cut of the 10% that you have. So you're only doing 1% budget cut, and you have a 30% deficit. You see where we're at? We're really corrupting our government. We're going to go bankrupt, and it's going to hurt every program we have, including medicine.
So if you're looking at it as inefficiencies there, where else in government spending, in terms of healthcare, do we have inefficiencies that you see we can correct?
Whew. It's endless. That's what the Doge is all about. When you talk about government waste, the problem is a lot of things you're going to identify have already been spent. And so every year we rebudget, but it's the bureaucracies that have too much money to begin with. People hate earmarks, now called community funded projects, because it's when I put in, for example, my let's say I want to help build a bridge in Roswell or Alpharetta or something like that. And people are like, well, why would you be part of that waste? Because the government should have nothing to do with that. That should be local government funding that based on what their needs are. And I agree. The problem is it's already built into our budget. And if I don't spend it, the president, could be Biden, spends it on some turtle bridge in Florida or a train to nowhere in California that puts billions of dollars in people's pockets who are going to fund the Democrats in their campaigning because they got another stuffed pockets from the president. So if I don't spend it back on my district, it goes to somewhere, whoever the president wants to go on the slush fund. Now here's the real gist of it. I have a top 5 district of wealth in the nation. So we pay more than our fair share of taxes. So if I don't get those community funded projects back in my district, I'm basically paying for California and other liberals to live a certain life that they didn't pay into. And that's just not fair. But these are all just built-in harassments inside the government's bureaucracy that we need to fix. The problem is, for example, executive privilege. We just saw the pardons, right? Both Democrats and Republicans, massive, thousands of pardons. I'm pretty sure you talked about the Founding Fathers. Pretty sure the Founding Fathers did not intend for presidents to pardon thousands of people based on their political affiliation. People who had killed FBI agents or harmed law enforcement people or whatever. That's not the way it was intended to be. It was to correct egregious behavior by a judicial system that was out of line. And I think if everything's gonna be done by executive privilege or executive order, and like I said, I love it when Trump's in power because he does things I want to see done. The problem is when the Democrats come around and Biden does a record number of executive or whoever their next president, it could be Newsom, God forbid. And he does all kinds of things to reverse everything that Trump did and make it worse. Once again, that's not the balance of power that we, as constitutional republic, wanted. We wanted an equal balanced power between the Senate, the Congress, and the president, so that we'd have very slow, methodical change in government, not knee-jerk, one person making all the difference. And that's the way it's always supposed to be, because it's frustratingly slow, but it keeps the government from becoming more powerful than the people themselves. And that's the brilliance of the way that our founding fathers designed government, to have less government, to have less taxation, to have more freedom. The whole reason we broke away from Britain is because we were having taxation without representation. We were being overtaxed, and we didn't want the government telling us what to do. Now, guess what's happening? We're being overtaxed, and the government's telling us what to do.
You know, in terms of the founding fathers and what they would have viewed the original perspective as, in terms of your role and the money that you have to spend, unfortunately, in this case, or otherwise it would be spent elsewhere. How do you solve that problem? I mean,
by redirecting the budget. We're in control of the budget. I mean, the Republican Study Committee, which I'm on the budget portion of that, and I'm also on policy for the conference. The way we design our budget has to be much more thoughtful, much more engineered to have less government involvement. For example, there's the President Trump has this new thing where he wants to have AI sense cancer, some rare forms of cancer, some more plentiful, but early by basically cell count, and come up with treatments for stage 1 pancreatic cancer, for example, or anything, the different kinds of, it could be anywhere from liver, you name it. And all of a sudden you'll have something that you can treat very early, which actually could save us some money, but it's a $500 billion investment. Now, my question is the government responsible for that, or should we have the private sector? Because quite frankly, the private sector is outpacing the government in research anyways. If you look at space travel, for example, where you can make a lot of money, and Elon Musk has proven that,
yeah.
He's put more spaceships into outer space than all the other governments combined in last year.
Yeah.
Now, that is the first time that in history, since probably Pompey, when he could buy his consularship, raise his own army, and basically outpace the government. But since that time, the government kind of replaced all individuals. And there was a time not that long ago, in my lifetime at least, where only Russia and the United States could go into outer space. And we were leading advancements in technologies, computers, space travel, weaponry, you name it. It was all coming from the United States government funded stuff because nobody else could afford it. Now, the government can't afford it because we're spending all of our money on healthcare, Social Security, and things that are welfare things rather than advancements in technology. So we're relying on individuals like Elon Musk who and healthcare centers. Why can't these unbelievable explosion of wealth in AI and in health research where there's a lot of money, why can't they fund that instead of the government? Why do we need to get the government involved in that when it's going to be less efficient? Because now we're going to pick winners and losers, just like we did with solar panels, where we fund billions of dollars and make somebody very rich, and then they realize, oh, it's insolvent, we'll close our doors. They still have the money in their pocket. We just picked a loser on the American taxpayer's dollar. We should, if you want solar panels or hydro or windmill or anything, let them come up with it. If they can make money at it, it's great. But if your business model needs to be supplemented by the government, it's probably not a good business model to begin with.
Sure. And looking at that specific dynamic and where the government plays in so many different roles, and you talked about space travel, but then bringing it back to healthcare, what do you think that both parties agree on?
We both agree that there's fraud and waste and abuse. The problem is the Democrats don't want to ever cut. I don't call it cutting. I call it making it more accountable. I don't call it cutting. I call it getting rid of fraud.
Sure.
But because they want to win so bad, we can't even agree on how to save Social Security. And it's going to have an automatic 21% cut within 10 years.
What specific thing do you think we agree on, though?
Well, that there is waste. And there are some Democrats that will agree. And this is why I say we're going to have a bipartisan solution. The question is, will they have the backbone to vote for it and give us the win? Because when we're in power and we do something like that and they vote for it, that's a win for us because it looks like we're in control, and they hate doing that. And there's no saying, I'm not sure who coined it. Some people say Lincoln, some people say other, but it's amazing what can be done when you don't care who takes credit for it.
Right.
And this is the problem with government right now is everybody's so worried about who takes credit for things that we can't get anything done unless you're in power. And when I say in power, we have a very short window where we have control of Congress, the House, the Senate, and the presidency to get something done. But people are going to be very worried they're going to lose their seat, and we're going to lose the majority because they vote the wrong way. The problem is if you don't vote the right way, you're surely going to lose the majority. And so this is the crux. We have about 9 months to get this done because in the second year, now we're in an election season again.
Correct.
And everybody's less bold. They're more timid in those, and we'll get nothing done. And I'm afraid if we don't get a really good bill, which we just talked about the complexities of this and how the bureaucracies play into this, if we don't get something very concise in there about PBM reform, which we had in the original CR, and then Elon Musk said, oh, it's 1,500 pages. Well, that's 500 pages right there. So all the PBM reform that was good got thrown out because we wanted a more concise bill.
On that topic, explain to the average person listening right now, what does PBM reform look like? What is PBMs in general?
So PBMs are the ones that control the contracting between insurance companies and pharmaceuticals and hospital systems, and they're integrated from top to bottom. I mean, you look at United Healthcare, I think the number of physicians they employ and how they're tied into the pharmaceutical. Physicians aren't allowed to be integrated like they are. That's for sure. It's considered a conflict of interest. The way they contract and they strong arm people needs to be exposed. Quite frankly, I think PBMs have kind of run their course. They need to be trimmed big time. Now they're like, well, if we get trimmed, then the pharmaceuticals are going to make all the profits. That's why we have to be thoughtful that it doesn't become a boom for whoever has the best lobbyist effort, but that it's good for the patients. Every year we have a proposed or even a cut on reimbursements to individual physicians. Like this last year, I think it was 2.8%. Well, hospital systems didn't get that because we don't want to put the hospitals out of business. So when we talk about site neutrality, that hospitals and doctors should be getting the same reimbursements, well, realize that doctors typically can produce the same product for much cheaper than a hospital, for over 10% the savings. So when you decrease a percentage reimbursement for a doctor and he's like, I can't afford this anymore, he goes to work for a hospital system, even though you save 2.8% on his salary reimbursement, you just forced him into a system that's 15% more expensive.
How does that affect the average listener, the average patient?
So know that since we did that, we didn't have site neutrality, and now we paid that physician less, or we paid somebody more because of VA or TRICARE, and it imbalances the system. Pretty soon you have one system that's a monopoly in that section, and it's way more expensive. I'll give you another example. An oncology practice in a hospital system signs a PSA where the hospital gets to kind of control, since they're on that promise. If you don't sign this, you can't work at our hospital anymore as an associated practice. So now we're going to help you out, though. We'll sweeten the deal. We'll give you some kickbacks on some of the things. So a B12 shot that cost you $12 yesterday, now that they signed this contract with the hospital, now costs $150. That's what we're going to bill. Now, nothing changed. It's the same B12 shot, but the hospital system now controls that pricing on that drug, B12 shot, come on. But they get to do it legally. And it's a monopolistic
because of PBMs.
Not because of PBMs, but because of the hospital system. PBMs are a separate issue. I'm sorry, I'm confounding this because that's how complex this is. It's PBM systems. It's hospital systems. It's practitioners. It's mid-levels. It's nurses. It's techs. It's insurance companies. And it's a government, and it's private, and it's public. You see how complex the system is, and as soon as I start saying PBMs are the problem, then the PBMs will say insurance problem. It's not. It's us. It's the pharmaceuticals, and everybody points their finger at somebody else. And the only people that have been hurt in the last 2 decades, the only people who suffer are physicians and patients, the 2 people who are actually involved in the transaction that matters.
So how can anyone out there, even with all that complexity, how can anyone out there even understand, let alone make a decision on how to vote for the right person or whatever it might be to make a difference?
Well, pay attention to who's fighting for what. Now, there are certain people that just don't understand. If you're fighting for PBMs, oh my gosh, you misunderstand medicine tremendously. And there's certain Congress members out there, and I won't name them, pay attention to who's sticking up for PBMs. And look where the money's going. There's certain, you can see once this transparency really gets out there and people see where the money's going, if your representative isn't representing you, which means going after the waste, the excessive profitability, by law, protected by law, by the way.
Yeah.
By unintended consequences. Nobody wants to make it unbalanced. But some people are very naive or letting themselves be lied to about where the waste is, where the fraud is, where the abuse is, because we have the most expensive healthcare system in the world. It's also the best, but not the best by as much money as we're spending on it. And when you're talking about a $1 trillion economy, a multi-trillion-dollar economy, there is so much waste that we could be trimming, saving our healthcare system, making it cheaper for you and me, making it better simultaneously. We could lead the world for the rest of our lifetime if we do this right, or we can corrupt the system to the point where we go to a single payer system, the government controls everything, and only those people with the strongest lobbyists will survive and be fruitful.
So in looking at that, you're looking at your local congressman that you're voting for,
100%.
and being able to try and make an impact as the voter, as the person that's in the bed, as a patient, or you've got a loved one in the bed. How do you talked about so many different complex things that we're looking at. How do you even begin to understand you talked about PBMs are a big factor, but there's a lot of others.
Sure.
How do you begin to make a decision?
So this is where you have to either imagine if you're investing. Most people don't have the time to go out and figure out which individual stock is. And quite frankly, even when they do, they'll make mistakes because even experts make mistakes on stocks. Yeah. And even the experts in healthcare will make some mistakes. But you have to choose the people who manage best. I don't care if it's, and I'm not going to say a bunch of companies that, there's a bunch of companies who manage mutual funds and do the work for you.
Of course.
They do the research for you. You got to find your trusted. Imagine if a company was like a congressman or a local representative, because by the way, state also controls a lot of healthcare. Medicare, Medicaid, and then the way it's applied, how much they accept from federal government, which means you give up control. That's all, and the way they manage their health systems. And that's why each state is autonomous in some ways, and you can kind of pick and choose which states have better healthcare systems, because Maryland's way different from Georgia, which is way different from California, which is way different from Texas. Each one has the way, and you can kind of pick and choose and see which states are doing it right. And this is what I always say, comparing and contrasting is one of the greatest things we have as the United States. That's why I'm a federalist in the way that I approach government, that I want each state to be autonomous and independent, because then you can get to compare and contrast how taxation affects people. This is why we're having a debate on salt, for example. Those states that have really high state taxation laws, and the billionaires don't like it. And usually it's in places like California and New York and stuff like that. And they want to write that off from their federal taxes. Well, why would I want you to write off hundreds of thousands, maybe millions or billions of dollars of taxes from what you're supposed to pay because you live in a state that has bad taxation? No, move from that state. Oh, I know you love to live in there, but if your government's going to do that, take away the revenue and teach them a lesson. Yeah. Show them that if you're not going to be able to vote them out, you'll move out. And you'll move to somewhere where it is friendly. That's why Elon moved.
And you've got to see that. Yeah, I was going to bring up that example. You've got to see that with a lot of the kind of migration that's happened in the United States.
If you look about who's friendly to corporations, and you can say the same thing with medicine, by the way, but who has the best legislation for the way that lawyers, we need some reform on how we do laws in general, especially here in Georgia, actually. But by the way, we have one of the worst systems when it comes to the way our court systems are and the awards and everything else like that. The lawyers' lobby is very strong in Georgia. I know I'm making a lot of enemies in this podcast, very powerful enemies, but I'm just speaking the truth because I'm all about the people. Right. And if you have transparency where this money is going, you can actually expose this. And that's why both your local reps on the state level and your federal reps on the federal level are both integrated in the system that can expose where the problems are. And you can migrate. And that's why, by the way, Florida and Texas and Georgia and other places like that are gaining population, and other places like California, New York are losing population. The only way they're gaining population right now is through illegal immigration. Now, ironically, because of that, they could actually gain seats back that they lost in this last census, because California and New York both lost congressmen, which means they lost over almost 1 million people or more. As a matter of fact, California should have lost 2, in my opinion. But the only way they're going to make that up is by illegal immigration. Now you have people who can't vote, but do get representation.
But bringing it all the way back to the healthcare sector, and then looking at the bipartisan decisions that we talked about just a little bit ago, what laws do you think that we actually agree on on both sides that could actually make a lot of difference for the average listener out there? But right now, it's not getting done because of the just the entire volatility of the political scene.
So let's talk about things we actually voted for with bipartisan passage. The Surprise Billing Act. So when you go to the ER or to go see your physician, you get a bill in the mail that says you owe money. You're like, wait a minute, I have insurance. Why would I get this surprise bill? And it's because the insurance company gave you a denial, and now you have to litigate it. Well, Nobody thinks that's fair. You maybe had the worst day of your life, your appendix burst, and you use your insurance, and now they're trying to charge you, and your insurance company says, well, I didn't have an agreement with that anesthesiologist who intubated you, and so now you're stuck with the bill. Well, that's not fair. Why would you have to do it? You sign in good faith a contract with the insurance company, who signs a separate contract with the hospital system or those independent contractors in the hospital, and now you're stuck with the bill because even though you did the right thing, the insurance company and hospitals don't agree with you, and now you're stuck.
I'm trying to trust the system.
And so we wrote a law that says you can't do that. But guess what? It got abused over and over again. And the Secretary of Health, who's Becerris, who happens to be a lawyer, not a doctor, who's lost every single Supreme Court case this last year, I think four different Supreme Court cases, because he's on the wrong side of history, because he's sticking up for the lobbyists and insurance companies rather than for the people. So this is why elections matter. This is why laws matter. We wrote a very good law. Now he says, well, the law's not good enough. It leaves too much wiggle room. Well, no, you're interpreting it wrong, just like you interpret the southern border or anything. When you interpret the law wrong, and then I have to take you to court to prove that the intent of the law is what common sense would dictate. Of course I'm trying to protect the end user, which is the patient. This is why elections matter. So the average person and the bipartisanship doesn't matter when a bureaucrat or an appointee misinterprets it on purpose. There's nothing I can do to protect you from that other than say, elect better people. Know the character of the people. And when you have people appointing people that are going to harm you, which is just what happened. And I'm not just talking, you can research everything I'm saying. It is absolutely true when it comes to Becerris and what he did to the healthcare system and how he misrepresented us, how he wouldn't, you can't, as the insurance commissioner here, John King, I said, why are you allowing him to do this? Find them. And he said, I can't because it's an interstate agency. Only Becerris could do that, but Becerris wouldn't do that. He said, I want the local guys to do it, knowing they couldn't. And he had to write a letter back to Becerris saying, I can't do it, you do it. And he still didn't do anything about it. So some of this is built-in harassment. But bipartisanship, we both want, nobody in Congress wants to see their people suffer because they got a surprise billing. And they're still giving a surprise billing, by the way. I got a bill the other day for a healthcare that I knew that my insurance company was going to cover, but they hadn't ponied up yet. And they gave me a bill hoping that I would pay it before the insurance company kicked in. That's really illegal. And I called them up and I gave them the riot act because I'm like, this is what's wrong with healthcare and you guys are the part of the problem. You guys should be fined. You're lucky I can't find you because I would.
And it goes back to the point that people don't understand nearly or all, as far as I understand it, medical bills are negotiable, correct?
Kind of. So once again, the complexity is this. Let's say you go in and you don't have health care insurance. Now there's a rate that they would charge the insurance companies, right. But if you're going to pay out of pocket, they'll actually give you a discount.
A very heavy discount,
huge
by the way.
Discount.
I've noticed that myself.
By the way, if you get an MRI at one place and then you go pay out of pocket at another place, you couldn't have a more drastically different bill.
And that goes against the pricing transparency, right?
Well, it's not even just that. And by the way, some hospital systems have refused to do pricing transparency because they'll rather take the hit on the fine than actually do it. And even after they get fined, they don't do it. But quite frankly, that's how they pay for their bills, by overcharging in certain areas because they know they're going to get underpaid by indigent people that are forced to see by the government. I'll give you a statewide problem that was created unintentionally, or maybe intentionally, you tell me. I don't think that legislators a lot of times give thought to the unintended consequences of their actions. They voted in California that if somebody comes to see you, not only do you have to evaluate them and treat them for something that might be wrong, on your own dime, by the way, because even though they're indigent, we're making a law that requires you. It's called an unfunded mandate. That's across the board. You already talked about EMTALA.
Yeah.
But they went a step further. They said, you have to also give them a meal and you have to find somewhere for them to go at nighttime before you discharge them. So if you can't, you're housing them now. And now you have a backlog of patients you can't get rid of while patients are sitting in the ER dangerously. That was the unintended consequence because they didn't think that through. They just wanted the hospital to help them out with something they don't have enough government officials to do, which is feed and house people who are indigent. Yeah. Who are flocking to California, by the way, and this goes back to illegal immigration. Now you're responsible as a hospital for social services. And so you're hiring extra people for social service, which is extra expense. You see how this is a cascading effort based on legislative efforts. And so what people we need to do is bipartisanly, we have to be honest about this, where the money is going, enforce it, hold our government officials, our bureaucrats and appointees accountable for what they're doing, and write better laws that give less wiggle room for people to cheat.
And you've got that you talked about that it feels like a snowball a little bit with EMTALA. Starting in 1986, and then you got Medicare, Medicaid, and even CHIP, right, for children, where, you kind of look at the entire system and you look at, is it just the middle class and the rich that are paying for
Of course it is.
care?
100% it is. But that's we're paying for the government too. I mean, if you look at
Right.
almost half the nation isn't paying hardly any federal taxes. And once you get to a point where half the nation is voting to pilfer the other half of the nation, and that it's actually makes more sense to be poor than it does to work harder and be in the same place. If I have a choice between living the lifestyle I'm at right now and not working and having the same benefits I would as I start to work, and I lose my benefits the more I get from my work, you can say, well, you're getting the advantage of feeling like you're valuable, but human nature is, why would I work harder to gain nothing? So as I keep on working, I'm losing my benefits from the government, but I'm gaining it from work. But I'm working, now I'm not at home, chilling out with my kids or whatever. We need to fix laws that don't reward people for inefficiencies and laziness. One of the most dishonest things that ever happened, talk about transparency, is when President Obama reconfigured the way we do unemployment. It's no longer who's unemployed, but who's looking for employment, who's unemployed. You'll never be able to, when you say record low unemployment, it's not an honest number. It's a skewed number, and it always has been since the Obama administration. Now, Trump benefited from that too. But every president from here on out will benefit with these really low numbers that aren't honest. You can't compare it to anything before that because it doesn't compare to the Reagan and Clinton era because they didn't interpret it the same way. We need to have an honest debate about what actually exists, whether it be in unemployment, medicine, and in pharmaceutical costs. For example, insulin. Really controversial subject. Why does it cost more in America by 10 times than it does in Canada? Is it different? Is it safer? No. It's chemically identical and it's no safer. But we spend it because we have a monopolistic system that doesn't allow us to buy outside and create a competitive market. Now, we don't do that with other drugs like...
What's the solution to that?
Well, competition. Allow a free market system where everybody can compete for that insulin contract the same.
Does that have to do with pricing transparency?
No, it has to do with protectionism. Now, we only allow us to buy certain vendors because outside the United States, this is absolutely cronyism because we don't do it with penicillins. Now, we have one factory in America, U.S. Antibiotics, who produces amoxicillin and I think Augmentin in America. That's the only one left, and it's going bankrupt because it produces a superior product, but China's undermining all of our products. They've done it with other drugs too, all the way, and they undersell us because they produce an inferior product that has not the same, by the way, the same standards. And they're not, if I'm going to do a surprise visit on their facility, which we do here in America, but we don't do in China because we have to give them like a month's notice or something like that. And they can clean things up. And if you look at we don't do product sample comparisons by the federal government, so we don't know we're getting the same quality. And I'll make a bet with anybody out there that we compare Chinese produced drugs to American produced drugs. On the whole, you have an inferior product overall. And the government subsidizes it to force us out of the market, and then they'll corner the market and then force prices back up. This doesn't have to do with just penicillin, but with insulin and other drugs. When you allow a foreign national government to control the prices and control the supply, when you have a war, what do you think that's going to do to America? Where are we going to get our products? This happened during COVID when we had a lack of PPE and other things else like that. So if you're really smart strategically, you better have some people in America that can ramp up their production if needed, and also that you sustain that production here in America. And that's why we do some laws to protect that, but they're abused because once again, they're using pass-throughs to get around those laws through other countries and other vendors, and we need to tighten that up.
Are Trump's tariffs the solution to that?
Absolutely not. So tariffs can increase. So what happens with tariffs is you can force the price point up for those drugs, for example.
Right.
Now you could say, well, now look, the pricing is the same for both. And he could target it exactly on that market, for example. The problem is there's ways that they can sell it through Vietnam. And now Vietnam sells it to the United States. Well, now are you going to make one against Vietnam on that drug? And it's going to apply from everything that comes from Vietnam. Or, they find ways around tariffs all the time. And so you're constantly either increasing tariffs on other countries or other pass-throughs, or you're just forcing the price point of all drugs up anyways. And so tariffs have their utility in negotiation, but overall, somebody's paying for that tariff. Right. And we think it's the other country, but quite frankly, it's usually the end user.
It's the taxpayer, right?
That's it.
Yeah. So then what is the solution?
But by the way, I like what President Trump did with tariffs and renegotiating NAFTA and border security and other things like that, because it is a powerful tool. I just don't think it's going to pay for everything the way that
Healthcare wise.
healthcare wise is not going to pay for the bill.
So if that's the case and we're getting undercut by China and other countries like that, what is the solution pharmautically?
Well, so here, and this is where it kind of gets confounded. You know, the price points get confounded because I'm talking about buying more expensive medicines,
Right.
But they're cheap medicines
Yeah.
overall. You know, Moxicillin and Augment have been around
Sure.
for a long time, but that's strategically important to the United States, and it's a better quality project. So it's kind of like it's showing up something that's strategically important to you, and it's a pittance compared to the overall expense of medicine.
Yeah.
By the way, we probably need to make some really hard decisions on end of life, which is where you spend most of your money, is end of life. The last year of life for a lot of people, we're not really sustaining life, we're sustaining death. Quite frankly, we're not extending. Sometimes we keep people alive that you would not keep your dog alive that way. That sounds really harsh, right? Are you saying I shouldn't treat these people who have a chance at life? No, I'm saying you shouldn't treat people who are dying, who are going to die anyways.
Prolong.
Make it comfortable for them to die. Don't keep them alive during the scariest, most painful time of their life. You wouldn't do that to your dog. Why would you do that to your dog? Your dog literally can't get out of bed. Your dog can't eat right. You're gonna put a feeding tube in his stomach. He's not even meant to. He can't communicate with you and me. Not gonna improve. Why would we do that to a dog? That dog is miserable. Let the dog die. Death is not the worst thing for some people. Sometimes that extension, you're just torturing somebody who otherwise can't even make a decision for themselves. They're intubated. They got a food thing, and they're not going to get better. Why do we sustain that? You're sustaining medicine, but you're not sustaining life.
Taking a little twist back to what we talked about in the Founding Fathers. The U.S. Constitution never mentions health or healthcare. Do you think they left that out on purpose? Or do you think that entire kind of area is ripe for reinterpretation?
So they left a lot of things out. Now, we didn't have an imagination for healthcare at the time. Now, they did have dentures. We know that Washington had dentures, right? But he didn't expect the government to pay for that, did he? If you didn't have dentures, you found a way. There was scarcity in resources. We have more wealth in America than the world's ever seen. We have never lived in a time where we had more resources than we have now. Our poor people, think about this, historically, in the last 20,000 years, whatever you want to say humankind exists for. In the entire history of humankind, when have poor people been fat? It's the first time.
That's a good point.
Our poor people are the fattest people. So it's not lack of calories. Now, you could say it's lack of nutrition. Now, the way they even define it in government is when somebody's health resources are impoverished and stuff like that. It could be because you're too far from a grocery store. You're considered, there's a nutritional deficit. Well, you can have a billionaire who lives in the middle of a ranch, and you're considered part of that health impoverishment. The way we do statistics in America is insanely deceptive, and it's done to skew things to say the government needs to step in more. Like, for example, the way we calculate poverty. There's some people who are impoverished by standards, by the way we do statistics. They have cars, computers, internet, big screen TVs, game systems, but yet they're considered in deficit. You know, they're considered impoverished in America. And so we need to take a good look on how we think. Just because you don't have as much as everybody else doesn't make you poor.
But jumping back to the Constitution itself, I mean, does that mean the Constitution is or is not equipped to handle the healthcare?
So by the way, thank you for keeping me on track, because I'm very AD. You'll see me going all over that. This is why a good host, he's doing a good job as a host, because some people like myself will get off on these tangents that has some association, but not directly to the question that you asked. The Founding Fathers could only see what they could see. It's kind of like biblical principles, right? Sure. Transgenderism is never talked about in biblical principles because people are like, what are you talking about? That's not even a thing. The homosexuality was, but transgenderism not. I mean, we didn't have technology to chop somebody's privates off and pretend and give them hormones. It just not something you're going to talk about in the Bible. Same thing with medicine. We never saw medicine. We had doctors. As a matter of fact, the first McCormick that came over here was a doctor in my genealogy. half Scottish, half Irish doctor who bought his first piece of land in 1740. And here's where I'm going to bring it all together, by the way, which was surveyed by George Washington in the 1750s. It's a historical landmark in West Virginia. It's called the McCormick White House.
Nice.
Now, what's interesting, when he was a doctor, though, nobody could have foreseen that he was going to be able to give you antibiotics or do surgeries or save your life through the ways we can now. Now we have things that can extend your life literally for 70 years because as a kid, you had a disease that would otherwise killed yourself. That can save your life. But I don't think, even if you had a constitution that considered that and said, yeah, we need to do life-saving measures, which is what we do, right? You can't deny you any sort of consequential care that would kill
Emergency
you.
care.
Emergency
That's
care.
EMTALA, right?
That is
in
already
its
taken
essence.
care of, and it's been written into law.
Yeah.
But I don't think it was ever intended to take care of people who abuse their bodies by smoking and drinking. And now I got to give you a free liver transplant because you ruined your liver. No, I don't, luckily. Matter of fact, if you're a drinker and smoker, I'm not by law required to give you a liver transplant, but some people think you should. And some people, where do you draw the line? Now, dental care is not free. It's not covered by the Constitution, and not by EMTALA.
Correct.
By the way,
Yeah.
you have to go to the ER to take care of your toothache. If it's so bad that it's going to make you infectious, I got to give you antibiotics. Maybe send you to a dentist that does, pro bono work.
But it's all out of pocket.
But it's out of pocket, or it's at some special rate because it was negotiated, so they can pull your tooth. You're not going to get
Because it can be negotiated.
Yep, but you're not going to get
People
an
don't
artificial
understand.
tooth. You're not going to get capped for free. The question is, where do we draw the line? And this is where the Constitution is a living, breathing document. Some people want to say healthcare for all should be a constitutional right. It's as basic to life as possible. But I say, no, you're responsible for your own healthcare because of the way you take care of your body. Do you exercise? Do you eat right? Those are things. It's not that expensive to eat right. It's really not. Vegetables are not that much more expensive. Well, maybe it's a lot less expensive
If you really look at it,
than fatty meats. And there's a lot. Fast food is not inexpensive. I'm sorry. But I avoided fast food when I didn't have any money. I ate a lot less at restaurants that were bad for me because I could eat off of spaghetti, and actually spaghetti and lean meats, and I was in good shape. And I take a vitamin pill every day. You have all your nutrition. But we pay people to go to the store through SNAP or through welfare programs, and they get the worst kind of foods. Coke and fructose syrups and things like this. This is where John F. Kennedy Jr., this is where you talk about what we can do as individuals. Be healthy. Most of the healthcare that I deliver in the emergency room is delivered to people who could have solved their own problem to begin with, but didn't. When you overdose, when you drink heavily, when you're fat, when you don't exercise, when you don't do things to de-stress your life, you are part of the problem. Quite frankly, we as a people, this is where John F. Kennedy's proactive approach to healthcare literally would make America healthy again. When you had to walk to turn the channel on your TV, you were better than sitting in a chair, using a remote, and eating popcorn and drinking beer or soda and not doing anything because everything's at the tip of your fingers because you can get on your computer and get anything without having to go anywhere. And we jump in a car instead of walking or getting on a bike.
And you talk about being able to take your own action, which I 100% agree with, by the way. But then you dive into the things that you may not be able to afford. And you were given the Champion of Healthcare Innovation Award from the Healthcare Leadership Council in 2023, I believe. And you said, and this is a quote that we have from you: "We have much work ahead to provide healthcare to struggling families, lower costs, and improve lives." How do you see America actually achieving that affordable healthcare outside of obviously their own actions? They can make certain decisions dietary wise and things like that. But what is affordable healthcare? How can we achieve that while still granting personal freedoms, but still limiting government involvement?
So I'll sum it all up because this is kind of the crux of the issue, right? So if Americans were to take this seriously, some things are out of control, some things are in control, right? Things we're in control are actually the most expensive things. If we could just cut back on the obesity. Now, obesity in the wealthiest country in the world kind of makes sense, except for it's our poor people that are obese because they're eating at fast food restaurants. They're not eating right. You could say it's by design. Some people, this is where you get into books like Good Energy and other things that RFK tout that says we're eating the wrong foods. We're having these additives that are making us fat. We're designing foods to actually produce more calories instead of more nutrition.
The Red 3 ban recently.
There you go. So there are certain things we can control as government and say, But then other governments overstep and say, we're not going to give you a 32-ounce drink. You can only have a 22-ounce soda. Well, that's just not going to work. I'm just going to buy two 22-ounce instead of the 44-ounce, and I'm still going to circumvent the law. So you have to teach people what those consequences are, why it costs them not just money, but health and quality of life. So that's one part. Now you're going to talk about the things that we can't control. Some people are born into poverty and they have egregious issues. They could have a trisomy issue with their genetics. They could have a malformity in development in the womb. You can have people who just bad things happen to. That's just catastrophic. But that's a minuscule part of the healthcare. But those people, that's where the government's always been able to step in and say, we're the healthcare net for those people. That's why we have Medicaid, right? And that's been abused dramatically, though. People who could go to work don't work because I get free healthcare. So that need to work. If you're
so right there on that
able-bodied
topic,
person,
though, sitting there with somebody that does have that very minuscule, like you said, issue that they've got to deal with in any certain circumstance, and Medicare, like you said, has been taken advantage of. What is the solution looking?
So a requirement to work. If you're an able-bodied single person, now then you'll say, well, why not just have a kid then? I can protect myself. Well, you're right. That's exactly right. And we never want to reward poverty. We don't want to say because you're poor you get money. That is the wrong issue. We should get enough to get by, but we should always be with the premise that we're trying to get you out of poverty, not keep you there. That's what I love about philanthropic programs. There's Home for Hope here in Georgia where they don't accept federal funds. Now, it makes it harder to raise money, but the whole premise is you come in there as an abused wife or mother, and you have kids who are otherwise indigent. We help you, but the whole premise is to educate you, get you working, and get you out of the program. The problem with government programs, we get you in the program, and we reward you for staying there. As a matter of fact, the more able you get, the more we punish you. And it's the irony of that is just unbelievable. We design these programs to be permanent rather than temporary. Government help should always be temporary unless you have no ability. In other words, you're paralyzed and you're indigent, or you don't have family to take care of you. It was never intended to take care of everybody who has a problem. That's what communities, that's what churches, that's what families were always designed for. And the more the government comes in and replaces that, the less moral fabric and the more close and the less close we are to the people around us. That's the community fabric that makes us feel good. If you want to see something that's a shocking statistic, and this covers under healthcare in every way, shape, and form, two of the most prosperous countries in the world, Japan and the United States, who have more money, GDP per capita than most countries in the world, and who have more wealth. You're talking about the first and probably tied for third biggest GDPs in the world. Both have the highest suicide rates in the world. Why do we have such a high standard of living and such a high suicide rate? What is it that gives us value? Because quite frankly, you and I can have all the wealth in the world, and we've seen millionaires and billionaires commit suicide. Politicians commit suicide. The CNO of the Navy, the head person of the Navy, committed suicide. What is it that gives us value? Because quite frankly, if you're not mentally right, you're not physically right. And healthcare carries over to that too. And we as Americans need to figure out what gives us our value. And I think it's our social fabric that we've given up on. When I raise you, let's say you're my son, and I tell you, you're going to be such a great athlete, or you're going to be so wealthy, or you're so good looking to my daughter. And then when they grow up, they think, me, 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 me. How many Facebook friends do I have? How popular am I? How successful am I going to be? And then they don't meet their expectations because I told them all their life that this life was about them. And they figure out, oh, wait, nobody else cares that I'm the most important person in the world. Nobody else thinks I'm the most important person in the world except for my parents. Then they get depressed, anxious, and suicidal, and they use drugs and alcohol to compensate, or they become promiscuous. They try to find their other value, and it's not in God. It's not in family. It's not community. They lose their way, and they have this high suicide rate. What we should be teaching our kids, along with fitness and nutrition, is that this life is not about them. It's about others. And if you want to have a lot of friends and a lot of value, you look after people who are in need. And by the way, now that takes government out of the role, doesn't it? Now you have less reliance on the role, and you have a reason to live, and you're not suicidal. Because I've never met a person in this life who was invested in others who was depressed. Because everybody loves a person who's invested in them. And very few people like people who are only about themselves.
You are very correct on that. I couldn't agree with you more on that point. And then, but looking at, you talked about that's not the government's place. But then in your eyes, what is the government getting right then right now? In the case of healthcare, of course.
In the case of healthcare, we have given a safety net. We have looked after the indigent. We do have the best healthcare in the world. It could be more proactive, of course. It could be leaner and meaner, of course. But we've done several things to protect those people who are unprotected. We just made it far too attractive to people who would abuse that.
Which, do you think that's exactly why people don't trust the government in regards to healthcare in general?
The government should never be trusted. We are a country based on not trusting the government. The whole Constitution was based on not trusting the government. Minimal government, less government control, more empowering the individual. That has always been the American way. And the more we drift from that, the worse we are. And that's what the whole fight of it is right now. We used to be a bipartisan approach on that. We used to have very similar. I remember when John Kerry and George W. Bush had their debate, I was like, there's not much difference between the two. This is before I was political.
Wouldn't that be beautiful these days?
And I never went to a political meeting before I ran for office, by the way. I never went to a fundraiser. Didn't know any politicians. And then all of a sudden, the parties diverged drastically. And one party believes that government is the answer. The other party is supposed to not believe that, but a lot of times their actions don't really ensue that. But if you can see, the biggest difference is, the question is, do we believe that the government's the answer to our problems? Do we believe that the government's going to fix our healthcare and our education? Because the more that we've said the education is controlled by government, the worse education gets. The more they're in control of energy, the higher the price of energy is. The more they've gotten involved with healthcare, the more expensive it's become. You see how the government's really not the answer. We are.
So as a government official, how do you balance that responsibility?
So we divest. We divest. We get more and more people to figure out how to be healthy for themselves. Don't look to me to solve your healthcare problem. And by the way, I can't solve your education problem. I can't make you make your kids read. I can't make you be a good parent. I can't help you teach your kids not to use drugs. Now I can show you, and I tell you what, and you want to see one way that the government did a really good thing, because you asked, how do we get kids from stopping smoking? Because kids don't smoke anymore. They used to smoke cigarettes all the time.
Yeah.
When I was a kid, that was a problem. And then we tried to use, oh, look, there's a cancer patient, you're going to get cancer. Well, no kid thinks they don't see kids their age having cancer. So that's something that adults have problems. They don't think of themselves as adults. So it never registered. Getting cancer wasn't something that's going to happen to me. Just like overdosing is not going to happen to kids now. That's why so many kids overdose, because I wouldn't overdose. That was not me, right? You don't intentionally do that. So the way we got people to divest from cigarette smoking is we did an ad thing that said, corporations are making record profits off of your parents getting cancer. Well, now it becomes a moral issue. Well, why would I want to support them by smoking? So they made a choice not to smoke, not because it was bad for them, but because it was bad for their parents and because some evil corporation is making money off of that. Now, if you want to get rid of drug use in America, you teach kids that by buying drugs, yeah, you can get high, because they don't really care. They're just thinking, oh, it's fun to get high. But they're not thinking that they're actually supporting rapists, murderers, child traffickers, people who are overthrowing governments. Now, all of a sudden, you using drugs is about a moral consequence for everybody. Most people are not bad people. You want to solve that 100,000 overdose? Make it a moral issue from the time they're a little kid. Teach them. You want to see how government can step in when parents don't? You teach them that these are evil people you're supporting, which is the truth.
And how does government do that? Through
There's
ad campaigns?
Ad campaigns, education. Since we do have educational public schools,
Right.
You make that part of the curriculum. Because who's going to disagree with me? You think that overdosing is a good thing? You think that buying drugs is not supporting? Tell them the truth, and you'll set them free. And I think this is where you say, people complain all the time, well, you took God out of schools. And now I agree with that.
Yeah.
But once again, separation of church and state. But you can't separate us from statistics that are actually truthful.
Sure.
And it's freedom of religion, not freedom from religion. You can allow a godliness. You can allow certain moral standards that are universal to all people. If I come up and punch you in the face, you don't have to be Christian to know that's wrong, do you?
Sure.
That's natural law. There's certain natural law things we can all agree on bipartisanly. I don't care if you're Muslim, Jew, atheist, Christian, it doesn't matter, that we know are right, and enforce those things. Allow us to do things that empower our teachers and our parents to do the right thing. Don't support this DEI stuff that's never shown any benefit. Show me one piece of statistic that shows DEI works. What it does, it divides people. It didn't lift people out of poverty. It impoverishes everybody. It's not about it. If you want to say, oh, look, it works. We have more black people and this and that. Okay, do those black people have a higher education level? That's what I want to know, because that's what matters to me. When we looked at the way that we applied our COVID laws, this is once again going back to government.
And it goes back very closely to you with Morehouse.
Exactly. So when I was elected student body president at a school that's 60% female, 80% black, and 95% liberal, it wasn't because I was a white male conservative, obviously. Same year Obama was elected president of the United States, by the way. It's because they knew I was more about them than myself. They know if you're hungry, I'm going to give you some food. If you're having a bad day, I'm going to give you a hug. And ultimately, I just care about your day. And I want to make sure that we are working together, not because I get credit, because we can accomplish something together. As a matter of fact, my whole commencement speech was based on the premise of the diversity that existed in that school, but how we served the community as a whole. And it was amazing what we represented and what we were able to accomplish, and how the average student became better because the teachers cared that much.
And looking at what you were able to do as the student body president and kind of uniting the school potentially as a whole in that diverse setting, how would the government be able to do that in the stance they are in today with healthcare? How is that trust restored?
It's a great question. So I'm going to relate it back to why Morehouse was successful. Was it successful because of the price of the education? Of course not. Was it successful because the government stepped in and gave them grants? Well, you could say it helped, but it's not the reason. The reason is because of the people, the students and the teachers, just like the patient and the doctors, right? It comes down to the most rudimentary function, which is relationships. It's not about money. It's about attitude. It's about caring about other people. It's about a community that's not based on a government forcing you to do something by the point of a gun, whether it be taxation or motivation. It's about educating people, having people understand where the money's spent and how it's best going to affect our society. And usually that's done through philanthropic efforts, quite frankly, and allowing people to work hard and succeed and have the benefits of that hard work, rather than have the harder I work, the more I get punished by the government.
It was interesting as I dove into the entire topic that we want to discuss today and the government's role in healthcare, and then diving all the way back to the fact that George Washington had a smallpox inoculation mandate, but only for the Revolutionary War soldiers. And as a 21-year veteran yourself, in having to go through so many different vaccines, how do you view that in the light of the COVID-19 mandates?
Well, you remember John Adams had a daughter who was pretty messed up by the vaccination for
Correct.
smallpox. And for those people who aren't aware, it was a piece of broken glass, usually dipped in somebody who's infected.
Right, put right on the wound.
And we used to joke that the way you get chicken pox is expose your kids early, and they'll get over it before they remember, and it's not a horrible thing. The older you get and you get chicken pox as an adult, it's a miserable thing. Now we have vaccinations. And people who don't get vaccination for chicken pox will suffer the consequences. And the same thing for measles, rubella, mumps, whatever it is. We have lots of vaccinations out there. They're beneficial to society. And by the way, we're seeing a resurgence of some of those diseases on people who don't get the vaccination, and the fact that we're getting exposed from countries that are coming here illegally who were not screened medically. And it used to be we'd screen people for glaucoma. Now we don't even screen them for AIDS.
Wow.
And so you could give a lethal disease here in the United States. Now we're getting better. We now have hepatitis vaccinations and treatments, whereas that was killing millions of people back in the day. We're getting better at medicine, but you have to figure out where the detriment versus benefit is. And that's up to the individual, not to the government. And we all have to take risks. And by the way, when I treat you as a doctor, I am playing the odds. Now we're getting better at it because we can actually test your genetics and see which drugs work on you better. That's crazy. That's the advantage of AI and technology. And that's awesome. And that's just based on a society with great wealth that can actually advance technologies. But you're going to have to ultimately decide whether you want to get a vaccination for cancer someday. Well, now that's immunotherapy. I would, instead of packaging it as a vaccination, I'm going to say it's immunotherapy. It sounds much more palatable, right? Because we use immunotherapy on cancer all the time right now to great success. However, in some cases, your body's going to get an autoimmune response where it's going to actually attack itself, healthy cells. And by the way, that's what happened with COVID, in my opinion. We had autoimmune things where you get myocarditis, where your heart's being attacked, and you get inflammation because of its reaction to a vaccination. But guess what? You can also have that from the disease itself. So now you have to start playing the odds, and you have to figure out what's from the vaccination, what's from the disease, what age am I? Because an old person can have a very different benefit than a young, healthy person who could fight off of a disease that they've never been exposed to. And there was a time where swine flu actually had a higher propensity for death amongst young people than old people because they had been exposed to it, but the young people hadn't.
Wow.
So they had a natural immunity, not through a vaccination, but through exposure. So when you talk about avian flu or whatever the next pandemic is, everybody needs to decide for themselves based on an education system where one size does not fit all. And this is the problem with government. We're very lazy. When Fauci says everybody needs to be vaccinated, and I'm gonna make your life miserable if you're not vaccinated, he was not taking into account. This is why. Look at my interview of Fauci, McCormick versus Fauci.
I've seen it.
And the hearings where he literally, we used a clip of him saying, if you don't get your vaccination, you can't go to school, you can't travel. We'll make your
work at Amazon or
we'll make your
life
hard. And he got people fired over that. And he did it on purpose because one size fits all. I'm going to make from his little fiefdom. He could say, unless everybody gets vaccinated, you can't. Well, some people it's not good. If I'm already immune, and I've been exposed, I had the disease, I have a higher immunity than if you give me vaccination. Now you give me vaccination, my body reacts to that vaccine as an autoimmune response and starts making me sick. That's not good.
But looking at the two distinctions specifically in terms of you've got, I mean, as a U.S. service military man, you got 17. From my understanding, you got like around 17 vaccines. Is that true?
Oh, I probably had more than that over the years.
Really?
Because I had boosters and everything else like that.
Sure.
Some of them, because I was going into high route areas where you had maybe yellow fever or something like that only exists in that region, and so they would literally go after that region, whatever I was going to be exposed to. And I took prophylactic medications for malaria and other things like that. So I think sometimes it's very warranted, sometimes it's not. But we didn't, once again, we got so involved in this, and this is where conspiracy theories comes up with, and some of them may be true. It's not a conspiracy theory when it proves true, but when Fauci's invested in vaccinations, and he's the one pushing vaccinations for everybody regardless, even healthy people or people who are immune or people who have very good resistance, then you start going, well, why? Why would you do that? There's real harm. And why would you take away, and worst of all, and this is where people really don't trust the government. This is why this is why black communities who are liberal and white communities who are conservative actually agreed with each other. They don't trust the government. What do you know? We found something we agree on. It's bipartisan.
Sure.
And when you don't trust the government because the government's pushing something, and there's a big difference between me educating you, say, look, I think this vaccination may actually benefit you. People can actually digest it. Matter of fact, if I say we only have so many vaccinations, first come, first serve, they would have had a stampede, and people would have been clawing over each other to get to it. And we only have so many, and it's going to benefit most people. But if you educate people, and some people say, I don't want to get it, and you say, no, I really want you to get it. You say, no, I don't want to get it. You say, you got to get it. You're not going to force me. That's when people get freaked out. Why would you force me? So then the
government's role is a narrative that they have to play?
It is a guidance, not a mandate. When the government starts mandating things, it always results in bad things. Dictatorships, right? Societies are dominated by communists. Not just so, and when the government no longer says, I'm just going to divide the spoils like socialists, but I'm going to tell you what to do like communists, you can make the case during the COVID pandemic. We almost became like a communist nation. We can tell a business to close. We could tell them when you can come to work, what to wear. You could tell them when the government starts controlling wages, businesses, who's open, who's closed, where the money in the government goes to based on their political affiliation. What's any different from a communist country? Because quite frankly, even our corporate tax rates were so high they compare with communist countries.
So for someone that would argue that there's a compelling state interest in relation to something as dramatically, long ago as George Washington's mandate on smallpox, thinking that that'll be the reason that it helps them win the war, and even nowadays when we have service military men and women that are getting these vaccines, what's the difference that people should see?
We should always have a government that's not based on a blanket idea, but that it's an educated idea that you're allowed, first of all, you're allowed to disagree with the government. That was squashed during COVID-19. I was censored. I was threatened for disagreeing with the government. And you know what's funny? Everything I disagreed with government, I proved to be right.
What specifically?
On whether you should have blanket vaccinations, whether everybody should have to wear a mask, whether you should close businesses, close schools, how dangerous it was. All those things I was right on. Yet they censored me because I was misinformation. They made me look like a quack because I didn't know what I was talking about.
Was there a specific...
And this is while I was serving people on the front lines
right.
in the pandemic, and I had people who had never seen a patient telling me I didn't know what I was talking about.
And from my understanding, you were one of the only congressmen in the United States.
I am the only congressman
that served patients during COVID.
During the pandemic. Now, we may have some primary care doctors that came in this last election cycle, but during this last 2 years, I was the only doctor in Congress who'd served on the front lines of the pandemic. As an ER doctor, too, I'd say, if you're a primary care physician, you're going to be treating people with COVID. But if you're sick, you're sending them to the ER. I'm talking about the people I had to decide every day, is this patient so sick I have to keep him in the hospital, or am I going to take the chance with my medical license and send you home even though you're desaturated and you look sick? I had to make that decision every day. And it was agonizing. I had patients die. COVID was a deadly disease. It killed people. People who think it's just conspiracy don't understand how many people actually died from COVID. But when the government started skewing it based on reimbursements and states started saying, oh, we're going to use this as a political lever to keep your businesses closed, to keep schools closed, to plus up the coffers, then people got very distrustful of not only of government, but also the CDC and other people who are politicized. This is why you never politicize a disease. You never take it away. You allow physicians to disagree with each other and use science to debate this. And then you decide based on your education, your common sense, who to trust and not to trust. And some people are going to make the wrong decisions, both physicians and patients. But that's what makes America great, is we can disagree, and that's how we make advancements. And guess what? We're not all perfectly informed, but over time, it will sort itself out. After all, we don't all believe that the world's flat anymore.
Right. And going back to the root of the entire conversation, that's an extreme example, COVID in and of itself, but the patient care relationship, even before COVID, how did the government interact in your relationship with a specific patient? Was there any specific things that you agree or disagree with the way the government involved in that process?
I'm glad we have thorough notes. I'm glad that we have to document our patients. I'm glad that we have better sharing through EMRs and stuff like that. But once again, it shouldn't be one of those things that as we get better at it, they up the ante because they don't want to reimburse us. Because that's what it's turned into. It's not about patient care anymore. It's about me not wanting to pay you what you deserve to be paid. Whether it be Medicare, Medicaid, or insurance company, every time I get good at what you tell me I need to do, you change the rules so that you don't have to reimburse me. And so you increase my administrative burden to the point where I can't have my own practice. I have to rely on a hospital system. And now I have to have a more expensive healthcare system based on your requirements as a bureaucracy.
Is government action the solution to our healthcare system today, or is there any sort of
deregulation, competition, individual innovation? That is the key. Government is never the answer to our problems. Tell me one program other than the military, which I don't really want to put in civilians' hands. Even though civilians have come up with the innovation, we contract and control that very carefully because, quite frankly, one nuclear submarine can wipe out an entire world.
Wow.
Think about that. The power of one nuclear submarine, that's technology we control. I don't want that in civilian hands. I don't want this to be a Mr. Incredibles situation where one guy or James Bond can have his own island, his own weapon systems that can blow up the world. That to me is very scary. But when it comes to everything from delivering the mail, you can see how inefficient we become at that. We're worse at it now than we were in the 70s. Yeah. That's why, once again, go back to my hearings on DeJoy recently, where he didn't want to hear about it. He gave himself an A grade on something that's, in today's day and age with the technologies we have, we should not have a 70% deliverable rate on on-time mail. We shouldn't be losing mail. We shouldn't have crime in mail where it's getting pilfered.
I did see that. You spent like $6 on certified mail or something like that, and it didn't even get there.
Yeah, it got returned to me.
Yeah.
And then I had another one that was delayed for me like 3 months to get to me from 2 miles down the road. This is crazy in today's day and age. The government's not good at doing things, quite frankly. We're inefficient. We're too big. We're too politicized. And we're picking too many winners, losers. We're making rich people rather than a product that the Americans can use. And the less we rely on government, the better off we are. I believe in the power of the individual, whether it be in medicine or anything else. The more we divest from making decisions in healthcare, because we want to make it efficient. Democrats aren't evil people. They think they can make this efficient by one payer system. We can make it really cheap and everybody benefits equally. Sounds great on paper, but it really never has worked. Because what happens, we become very big and inefficient. And the biggest spending item of government, you can't tell me you're going to make that more efficient. The reason the Marine Corps is better than the Army, in my opinion, is it's smaller. Quality control is always easier with a smaller organization. The more, you can say it with anything. I mean, the bigger something gets, the harder it is to control quality control. Look at any business. That's just how it is.
So if you could make one change and implement one specific law or something like that to improve the system, what would it be?
Let's start with getting rid of the fraud and the waste and the abuse. Things we know are out there we can identify and stop bad guys from, punish them and take their ability away to rob us of hundreds of billions of dollars. And I say that's across the board things that we can do on all government spending. But
how do you do that?
Special healthcare. We got to identify line items such as Medicaid fraud or payment neutrality issues. We expose where the money's going and don't allow special contracts to abuse the taxpayer. That's just all through writing really good legislation, following through on once we get that pricing transparency, identifying the waste and getting rid of it. It's just like if you're going to deport illegal immigrations, start with the criminals. So if you're going to get rid of waste in medicine, start with the criminals.
I like your perspective, and as an MD and as a congressman today, you've given us a lot of different things to look at. Hopefully the listeners learned a lot, so I appreciate your time today. I appreciate your service as a military man and as a congressman, and I appreciate your time as we've tried to educate the average patient on just understanding what the healthcare system looks like and the government's role in their daily lives.
It's my honor. I appreciate you guys exposing the truth, and hopefully we'll continue to work together. And I'll give you more and more specifics as we go, and hopefully I'll come back on and we can talk about this specific piece of legislation helping healthcare advance in the right directions and become more efficient.
I love that. Sounds like a plan. Thanks, Rich.